Welcome to Lecture 2, Directional Terms. This whole lecture is going to talk about directional terms. Here is a list of the directional terms we will cover. You can always use this slide to come back and review each of these directional terms to make sure that you understand the difference between them all. Anytime you're talking about a direction of the body, you always have to go to anatomical position. A lot of times people get confused about certain body motions because they don't put themselves in anatomical position. So anytime we're talking about anterior, posterior, external, internal, you must put yourself in anatomical position. The first directional term we're going to talk about is anterior, posterior. That would be the front or the back of the body. Another term for that could be ventral and dorsal. So anterior is the front of the body, so is ventral. The back of the body is either posterior or dorsal. How I remember the ventral dorsal aspects is I think of a dorsal fin, which is on the back of the shark. The next directional term we're going to be talking about is superior or inferior, which means above or below. So superior is above, inferior is below. You can also sometimes say cranial or caudal. Cranial means towards the head, caudal means towards the tail, so below. Then we're going to talk about medial and lateral. Medial means towards the midline. Lateral means to the side. We have proximal and distal. Proximal means near the center of the body. Distal means distant or further from the center of the body. So if you're looking at your lower extremity, you would know that the hip is proximal to the knee, where the ankle is distal to the knee. And then we have superficial and deep. Superficial means closer to the surface, and deep means either inside or away from the surface. So you can always think of when they talk about she is very superficial, it's usually because everything is more concentrated on the outward appearance. So superficial and deep. Now we'll discuss terms related to sides of the body. So the first picture you see there is unilateral. That's one side of the body. The next picture is bilateral, both sides of the body. Then we have ipsilateral, which means it's on the same side of the body, and contralateral means opposite side of the body. Now that we went through all the terms and the physics terms related to how we're going to apply this in physical therapy, now you can go to Brightspace and participate in a couple formative kind of quizzes to make sure that you understand all the terms we have went over today. So on Brightspace, there's links to the visible body and to kinesiology and actions, and that way you have some active assignments before you come to class, and we will learn how to apply these terms to PT interventions. Thank you.